Thank you, Inspector Alana Dunlop, and for your continued commitment and support for continued collaboration and coordination in our work. So it's my pleasure now to introduce our next speaker, Dr. Jennifer Charlesworth. She is British Columbia's representative for children and youth. Jennifer has worked in the BC social and healthcare sector since 1977 in frontline child welfare, social policy, program management, and executive roles, and was engaged in formative work on de-institutionalization and community inclusion for people with disabilities, women and girls, health, mental health, and youth services. As part of her extensive background in the service of children, Jennifer has taught child and youth care at the University of Victoria. She has been the Executive Director of the Federation of Community Social Services of BC and is the founder of the Leadership 2020 program for the Federation. She's also been involved with InWithForward and for the past 2 years has been working with Chief Wedlidi Speck and other leaders to inspire culturally safer workplaces for Indigenous staff and people served. Jennifer has her PhD in Child and Youth Care from the University of Victoria and an MBA from Oxford Brookes University in Oxford, England. She is the parent of 2 vibrant young women who remind her daily of the power and promise of young people. Please join me in welcoming Dr. Jennifer Charlesworth.
Good morning. What a pleasure to be here. And as a way of beginning, I want to acknowledge that we are able to gather here today, and I'm very grateful to be able to gather on these traditional and unceded territories of the Musqueam peoples, and where the gatherings often included Tsleil-Waututh, Squamish, and Tsawwassen peoples. And it's always important for me to begin in that way because I am reminded when I say whose lands we're on, of the work that has gone before us for generations upon generations upon generations, and particularly in the way of creating healthy and cohesive communities before contact. So with that, and recognizing that we are being listened to in our work by the ancestors, I wanted to share with you a little bit about the Representative for Children and Youth. How many of you know about our office? I'm curious. Oh, good. Okay, some of you don't, though. So that's good for the opportunity to share a little bit. I've been the representative for the last 14 months. I'm the 3rd one. I've applied every time it was available and didn't get it. And I am so grateful to now have this opportunity after 42 years in this field, and particularly in the last 20 years of really having to do a lot of work to rethink or reconstruct myself after, as you can imagine, 1977. If I were to put a photograph up there about the things that we were trained on back then, it would be B.F. Skinner. How many of you remember B.F. Skinner? Okay, so I was working in residential treatment, and it was about token economy and behavioral management and that kind of thing. There wasn't very much heart. I didn't last very long in that situation. I had to find my heart and my way back to that kind of work. But what that meant, too, was, of course, back then, no one talked about residential schools, the 60s scoop, even though we were actively engaged in the 60s scoop in the 1970s and 80s. So it's been a really interesting journey, and I think I'm finally ready to do this job. So, but I want to talk a little bit, just set the foundation, because what I have for you today are some data. And I want to situate that and share that with you because I think it's so important that we understand the impact of violence on our children and youth and our young adults. So I want to, I hope, shock you with what we learn through our work. But let me just start with who we are. We're an independent office of the Legislative Assembly, so it means I'm not government. It also means they can't get rid of me for 5 years, so I can keep speaking truth to power here. Similar to the... Yes. Not that I haven't in the past, but sometimes I haven't been able to keep my job then. So we are an independent office created in 2006 after the Honourable Ted Hughes' report on the state of child welfare in the province of British Columbia, and he felt strongly that there needed to be an independent oversight body. So it means we're not government, but it also means that we have to work very closely to understand the context in government and community in order to do our work. So our job is to influence, I like to say, inspire, invigorate, agitate, and advocate. Sometimes we're just thought of as the advocacy body, but there's so much more that we can do to lift up the work that's being done and the ways in which we can do that in a good way. But fundamentally, we want to bring about positive change in the lives of the most vulnerable children and youth and young adults in this province. So very quickly, again, to situate the data, there are 3 statutory areas that we're responsible for. Advocacy is the first, and it was lovely hearing Alana talk about the advocacy. Of course, we are not alone doing advocacy work. I have worked closely with Tracy and with EVA and with CCWS for a number of years, and hands up to the extraordinary work, and what a journey it's been to see it evolve and shape public policy in the province of British Columbia over so many years. It's incredible. So I know we're not alone in advocacy, but we do have a niche role. So our advocates are based in 3 offices, Prince George, Burnaby, and Victoria, and we serve any community in this province, and our advocates can walk alongside young people, with the people who love those young people, in order to ensure that the services and supports that they need in order to be healthy and well are provided. We hear very complex cases. We're involved sometimes for a short while to provide a young person with some self-advocacy supports, but sometimes for 11 years because of the nature of the needs and the fact that the system is not designed to support that young person in a good way. So advocacy is really, from my perspective, the backbone of our organization. It's so critical. The other thing you should know is that although many people don't know this, we are primarily focused on Ministry of Children and Family Development, but we can actually present public policy issues on any area that we think impacts the vulnerability of children and youth and their well-being in the province. I'll come to that later when I talk about a little court case we've had recently. But I think it's really important to understand, too, that we can advocate alongside young people from the age of 19 to 24 if they are eligible for or receiving services from Community Living British Columbia or agreements with young adults, which is so important. That's a new area for us, and we're just starting the outreach to let people know, because as you know, 19, that's a cliff if you've been involved in the child serving system. So we need to do some work there. The amazing thing is that we've had over 20,000 advocacy cases that we've been providing support to. We have at any one point in time between 1,500 and 1,800 advocacy files going on, and we get some really good insights on the kinds of patterns and the issues that are going on in this province. So that's a powerful thing for us to think about, the systemic advocacy and what do we need to address going forward. Our second program is Critical Injuries and Deaths, CID. Now, this is what I'm going to spend a lot of time sharing the data on. So, by law, the Ministry of Children and Family Development, if a child experiences a critical injury, which is life-altering, or a death, and they have been receiving services from the ministry for the last 2 years, then we are required to submit to us a reportable circumstance, RCs as we call them. We get between 250 and 290 of those a month. So, yes, it's staggering. Now, I want to say that that number has been increasing. Actually, we're anticipating another increase this year of another 16%. It's been 27% over the last year and a half. Now, what that is actually not an indication that there's more injuries being experienced, but the ministry is being a very, very good partner. And they are actually sharing this information with us. So I'm very grateful for that and the work that we've been able to do to build some strong bridges with the Ministry of Children and Family Development, because we're all in this for the same reasons. We want our kids to be healthy and well. But one of the things, the other thing is, not such a great partner, health authorities are also required by law to submit reportable circumstances. We haven't got any of those yet, but we're working on it. 12 years in. So that'll be really interesting because that will bring data in from mental health and substance use particularly, and that will help us understand more about what's happening to our children and youth. So, let me tell you about those. So when those reportables come in, what my staff do is they look into what's the story, what's happened to that child, not in an in-depth way yet, but we want to take a look what's led to the circumstances that have given rise to their vulnerability and that injury. And that, again, teaches us a tremendous amount. So every month, I review every one of those files that the investigators have brought before us, as does all my executive. We meet for half a day. We go through everything. And what we're looking for there is, are there things that we can do right now that would be in support of that child because we see them being vulnerable? So that might be we refer it to the ministry's director of child welfare. We phone up the executive director of service. We assign an advocate. So those are the things where we think right now that child needs someone walking alongside them. How can we be in service? But other times we're taking a look at what are those patterns? What are the things that are coming up over and over again? What do we need to understand so that we're not always responding and reacting, but can we back it up? Can we figure out what might be important to do? So it's a very vital role. And of course, what that often leads to is us talking about these things in a public way. So we can do aggregate reviews. If anybody follows us, we did one about a year ago now, Time to Listen, which took a look at the experience of young people and substance use. And I'm just going to say this, one of the things that was very powerful there, because we looked at our data, we spoke with 100 young people in depth, and we took a look at what was going on in the field. And what young people told us was that the reason they used substances was to numb emotional pain. And many of those young people had experienced domestic violence. So we can do that. And just a couple of days ago, we released our latest report called Caught in the Middle. And that one actually was an interesting one for us because it spoke to interprovincial issues. So our third area is monitoring. And that researchers there monitor, review, and conduct analysis into government programs. And they take a look, again, at some of those things that are recurring themes that could benefit from an in-depth look that's not focused on a particular case or cases. So right now we're doing a beautiful piece of work on fetal alcohol spectrum. We're doing a cool piece of work on youth aging into adulthood. We're now exploring the early years, and we're taking a look at care planning. So those are our three teams that are mandated, but within that is our newly, it says here, Indigenous Strategies and Partnerships. As of yesterday, it's now First Nations, Métis, and Inuit Relations, and soon to be recruited brand new deputy, and it's a brand new team. And what that is so important for us is because there is an over-involvement of the child welfare system in the lives of Indigenous children, youth, and families. And the outcomes for those children is not what we would want for any of our children in British Columbia. So it used to be ISP, now it's FINMER. But FINMER, First Nations, Métis, and Inuit Relations, helps us build the relationships that we need to very clearly with the Indigenous leadership. That's been the primary focus of my first year. Grounding our work in Indigenous ways of knowing and being and doing, becoming a culturally safer organization. So we've heard the talk about cultural humility. That's absolutely critical for us as service providers to walk in a way with that humility, because that creates the conditions in which we can meet one another in a more appropriate way. So we are also, in that team, has the responsibility for monitoring the implementation of the TRC calls to action and the Missing and Murdered Indigenous Women and Girls calls to justice. And we will be monitoring government's implementation of that very closely, and we will publicly report as an independent oversight body on what we see. Also related to that is Jordan's Principle and the Canadian Human Rights Tribunal. And if you do follow us, I have some pretty strong words to say to the federal government these days about their opposition to the rulings from the Canadian Human Rights Tribunal and compensation for children who've been harmed. So that's a little bit about us, and we serve a very, very broad array of young people, clearly. And I think it's important to remember that it's across the youth lifespan, many different experiences that young people have, certainly children and families, and child protection is key, but also mental health, substance use, children with special needs, the youth justice, early years, that whole area is really important for us. I'll just quickly do this. There's some of the things that are going on for us. We try and think about the ways in which we can bring life to and light to the areas that we think are important from a public policy point of view. So I've mentioned the transitioning into adulthood. I'm very worried about so many, you wouldn't believe the number of injuries at 18 and a half to 19. And as we're starting to take a look at that, it's because they're scared and not feeling very hopeful. So that's a key piece for us. Of course, many people have done great work in that area already, so it's a matter of how can we lean in and help the work that's already going on. We're taking a look at youth homelessness. That's been done in collaboration with a young person with lived expertise. I'm very excited. I will talk a little bit later about representation and voice. And we're doing one pertaining to mental health detentions, but we're really excited about doing one on high conflict family law cases. And just recently, well, we've been working on this before my time actually, and I came in to this role and wanted to carry on, and I'll share a little bit about why that is. But what we have noticed is that there are an extraordinary number, far too many young people who were caught in the middle in high conflict family law cases, sometimes for 8, 9, 10 years of age, or 10 years overall. So they've been 3 years of age and now they're 15 and they're still dealing with the conflict that's come before them, and they don't feel like they have a voice in what's happening to them. And of course, many of our policies are designed for the majority, not for those that are dealing with situations in which violence is being perpetrated within that relationship. So we wanted to take a look at that, and we were opposed by the Ministry of Attorney General. I spent about 9 months trying to negotiate that, and finally I felt so strongly that we had to move forward and assert my right to speak about public policy that affects our children, so we went to court. And I'm happy to say that 3 weeks ago we won. Yes. Then, of course, we had to wait to find out whether they were going to appeal, and they decided not to appeal. So I'm very grateful for that, and we expect on Friday that we will receive mountains of documents from the Attorney General so that we can begin to do our work. And I think the reason is it's not about wanting to conflict with Attorney General or mess it, get about into individual family law cases. But when we see patterns, any of us, we have a duty to do something about that. And we were seeing patterns around what was happening to kids in those high conflict situations, and their voice is not being heard. So the other thing we've been looking at is doing a review specific to domestic violence. Not entirely sure how we're going to scope that out, so I welcome feedback, and I do have an ask of you at the end of my time, because we see that it's a significant factor in the experience of children and youth in this province. So let me give you some of that. So this is just, by the way, I will make sure that you've got copies of the slides, so you might not be able to see all the details, but basically what this is just to put it in context, this is the number of critical injury and deaths reportables that we receive that are in our mandate. So we get about 2.5 times more than this. We review everyone, but sometimes they're quote-unquote out of mandate because, for example, they haven't received services in the past 2 years, or the child has subsequently aged into adulthood, etc. But the bottom line is that it's a lot, and it's growing, as I've said. So I better catch up with myself here. So that gives you a context. There are a lot of things, but bear in mind as we go through here that we're going to take a closer look. So we're just going to keep diving in, going deeper into the material so that you understand what we have learned about children and youth and domestic violence. So this gives you an indication from April 2018 to August 2019 of the number of injuries and deaths that are directly associated with domestic violence. So, and remember, this is a this is a significant population, but it's not all children. This is just the children that we've come to know through our work. So 511 children altogether have been impacted. And you can see that there's a gender-based breakdown there with 318, from an injury point of view, 318 female identifying, 163 male identifying, and this is a trend actually we've been seeing more of, is gender diverse. We've just started to code for that, and we're now working with the ministry to encourage them to actually, so we have to dig often to find that, but what we're finding is a growing number of gender diverse young people that are becoming known to us. So that kind of gives you a bigger sense, and here's a little bit about the gender breakdown. And here is a little bit more about age. So we definitely see that the injuries associated with domestic violence are more critical the older in the youth age, so 13 to 18 years of age. So that's really interesting when you think of what's happening for those young people as they're creating their sense of identity, creating a sense of who they are and how they relate in the world. So it's important for us to understand where are some of the challenges. So this is a slide that speaks to how we take a look at the domestic violence data and take that 511 and take a little bit closer look at it. So we code for a number of things about what's happened. So the vast majority of the domestic violence cases that we're taking a look at, what we're seeing is what's called emotional harm. So what that looks like is that a young person has witnessed being embroiled in a situation in which someone who is important to them has been harmed or killed. So we are seeing that number grow quite significantly. And that's probably a good thing. I don't think that's a sense of it's actually a higher incidence, but I think what it suggests to us is that more people are recognizing that it is harmful to be a witness to. I mean, we've known that for a long time, right? But it's now being recognized within the service delivery spectrum. So that's important. So the other thing that we're seeing, of course, is children experiencing physical assault within the context or physical harm within the context of domestic violence. And there is actually a growing number, and I actually think this is a growing number because of what we've been noticing through our calls of sexualized violence that's attached to that. And I'll unpack the sexualized violence a little bit more too for you. So, and here's another one. So this speaks to, oh yeah, there you go. It speaks to the kinds of things that young people are experiencing with respect to violence. And some of the other things that are going on in the way in which that actually manifests itself in self-harming behavior. So let me show you this, and this one might be a little bit hard to read, but what we just have begun to do is we've gone back into the files, and we are taking a look at, in that child's backstory, what other things have been going on? What have they experienced? So what this basically says is at the bottom, the highest bar there is parental substance use. I was speaking the other day, a couple of days ago, with health authorities. Health authorities saying, okay, you know, this is a real thing, and the Pathway to Hope actually doesn't talk about parenting and substance use. So that's very significant. But what's the second most frequent thing that has happened to children? This is all children, not just us 511. All children that are coming to us that we are seeing in the course of our year, 45% of them have experienced domestic violence. That for me was staggering. Really important that we pay attention to that. So I'm going to skip over that. I'm just going to talk briefly about sexualized violence. And this is the way we code it: a sexualized act committed on a child or youth without their consent. It might be a physical act, but it may include non-contact, unwanted sexual experiences such as invitation to touch, luring, or threats. Sexualized violence is non-consensual in that the child, youth did not or could not consent. And it is also non-consensual when the child or youth is not able to consent due to age, mental capacity, or other factors. So we have all these coding criteria. So what are we seeing? We're seeing sexualized violence again showing up. And I can tell you that one of the things that I am most concerned about is a cohort of young women between the ages of 15 and 18. Significant overrepresentation of Indigenous young women or female identifying. And sexualized violence is very prevalent in their lives, as well as also a number of other factors. And the complexity is such that the system doesn't know what to do. And how the system is constructing these young people is they're not we've been given lots of services, but they're not engaging, or they're resistant, or something like that. So it's been fascinating for us to look at the narrative that's being constructed around young people that are experiencing sexualized violence, and who, for a variety of reasons, are saying, you're not offering me what I need, so I'm checking out of what you have to offer. And for me, that calls us in as a society to say, we have got to do something better for those young people. So that's an area that I'd love to explore further, and that we will do a special report on that with the encouragement of First Nations Leadership Council and Métis Nation BC. So this will give you some context for the way in which we understand sexualized violence. So of course, the majority were for female identifying, and 4 for gender diverse. Again, that is growing. We're seeing every month it's been a steady increase, largely because I think we're getting a better sense of how to find those young people, because they're not, oftentimes they're not being supported in their gender preference or in their gender identification, so sometimes we have to dig. So really important to consider what's the age at which they're experiencing this, and what are the kinds of circumstances that have given rise to it. So this is also really shocking and terrifying for me when we take a look at indigeneity and what's happening for young people and what they're experiencing with respect to sexualized violence. And again, what's happening for those young women is we have not figured out how, in the complexity of their lives, how is it that we better support them. So, of course, all this impacts the well-being of young people. We know about the brain and the kinds of things that are important for a typical developmental trajectory. When a kid knows that survival's kind of taken care of, then they can move on and they can begin to develop their social emotional relationships and their thinking mind, etc. And they've all got an opportunity to kind of figure out how they're going to navigate the world. But when a child has experienced domestic violence or sexualized violence, then the brain is impacted very significantly. And we know this, right? It affects in so many different ways. Childhood trauma, and it was lovely to hear the comments made by Myrna earlier today. So what we know is that this is really complex, and that we need to do some pretty significant reimagining of how we're going to respond, with an understanding of trauma-informed practice, with an understanding of resiliency. This does not mean that the child is perpetually damaged, but it does mean that there's an impact. We're doing a report right now on an intergenerational situation in which a young person passed, and what happened to her mama happened to her grandma and happened to her in terms of the violence that she experienced in her life. So we've got to really understand the intergenerational and inherited trauma and how that gets impacted, but we also have to hold that there is a way through this and that we have to show up in a different way. So where are we going to go with this? So I think that it's really important that we think about the ways in which we collaborate and how we do our work. As I mentioned earlier, I have been a long-time fan of EVA, and over the last number of years coming to know CCWS's work. And I know that there is exceptional practice in this province in some areas. And there's a lack of good practice in some areas with respect to collaboration. And in the work with CCWS, I was really beginning to understand what are the things that make a difference. What is it that the connective tissue within a community? And one of the things that I learned, and I have seen over and over again as representative, is sometimes if our egos get in the way, or if our territory gets in the way, our sense of this is our area of practice gets in the way, or we've got a code of conduct and therefore we can't share the information, that kind of thing, those are the things that become problematic when we're trying to do the best work, because as I said earlier, it's not a simple thing. It's complex. There are many other factors going on. Lifetime piece that I showed you, poverty, for example, that's what's going on. There's lots of different things. So while there's lots of good work going on in the province, what concerns me is I see pockets of what I call hotspots, where things are not going well, and we see the impact in terms of the well-being of those children. So I think it's critically important that we have to focus on those cooperative approaches. We also have to think about how is it that we work in partnership with the people affected. So those girls that I talked about, how is it that we connect with them to understand what it is that would make a difference for them? How is it that we can create more of a harm reduction approach so that we can stay in relationship, we can care and walk alongside them on their journey? Also to understand the whole importance of healing and all the different ways that can happen, particularly for young people that might not benefit from the typical mental health systems that we've put in place and might need something very different. We're doing some work on mental health detentions right now, and I'll share about that in the workshop this afternoon. And we are certainly learning that there are a lot of things that people can see for their own healing that is not built into our system. I think it's also really critically important that we call in the circle on cultural safety, cultural humility, really understanding that this work is fundamentally relational with each other and how we support one another and lift each other's work up, but relational with the people served. I'm just going to shift gears a little bit. We're learning a tremendous amount from, this is sticky notes. I'm going to ask you to do sticky notes or pieces of paper for me. But we're learning a tremendous amount from the people that are being directly impacted. They're telling us incredible things. They were also learning an awful lot from communities and how they are seeing the phenomenon within their community. And it varies from place to place to place, as people within this room know well. But listening into community and finding out the kinds of things that are making a difference in a community and how we might amplify and support that. One of the things that we have been excited about is to see that there are domestic violence courts in British Columbia, but I can say that we're overall very troubled by some of the things that we're seeing within the court system, and think that the work that Myrna is doing, I think I'm very excited about that, because I think that the courts are not our friends in some ways in moving this forward, because of the way in which unconscious bias shows up, the ways in which the court system has been constructed. And I'm just going to take a moment and find my courage here. So I am a survivor of domestic violence. I don't tell that story very often because I feel like I had so much that helped me get through that. Friends, family, transition house, Children Who Witness program. My kids were little at the time when I fled, very little. And I went through a 5-year process with the courts, during which time my ex made numerous reports to Children and Family Development. I was actually treated very well by MCFD because I knew that they had to do their job and take a look at what was going on in my family and with my kids. But I also knew what the system entailed so that I could kind of understand. But at the end of 5 years, I lost my home. We were housing unstable. I was $125,000 in debt because of legal fees. I didn't own anything. I borrowed a car from my parents. And I had 2 little ones. So by that time, they were about 6, and I fled when my kids were 1 and 3. So they were about 6 and 8 at the time. So, but worse than that, the consequences, the financial consequences, was that loss of voice, the loss of my own sense of my own well-being and my identity and my fear. I was terrified. One of my children was abducted. I was threatened my life. I don't think I breathed until until my kids were 19, because I thought, okay, now they're through this. Now I can breathe. I don't need to be on high alert. I think of the brain and what's happened to my own brain. So thank goodness for all the supports that I received and the fact that I had an education and could make an income and all that kind of thing. And it's not been lost on me that it was a very hard road, and I had many, many privileges. The way in which I was constructed in the courts was hysterical, emotional, manipulative. Again, how do you kind of reconcile that with what you're trying to do for your family? So as I move forward, I think we have that was a number of years ago, and I've been very mindful as the representative coming in that it's not about my story, it's about the stories, the many stories out there. And what saddens me and why I had to go to court in the way that I did was that there are the same kinds of stories getting played out. And if we listen to our young people, they are telling us what the impact of that kind of high conflict situation is, what the impact of being subjected to domestic violence and not being heard or not being understood. So I think that we have some very important work to do, and my hands go up to you for the work that you do every single day. Believe me, I understand the emotional work that you are doing, and I'm very grateful that you're there, because I know the difference that it made in my life and in my children's life. So I have an ask of you, and that is we need your feedback. We are only as strong in the RCY as the feedback that we get from community, and you are our community. So what I'd like you to do is, on a piece of paper, or I'll set some sticky notes out, we've got all day, I'm here all day, is what are you concerned about from your perspective that you think we need to pay attention to in order to make a difference in the lives of children, youth, and young adults who are experiencing domestic violence? And the other thing that's important to me is, what are you proud of? What are the things that you're doing, the practices, the programs, the approaches that you're taking that really speak to a way of doing things that addresses those fundamental issues that we're talking about? So please share that with me. Because I tell you, this feedback from community helps construct our agenda and the kinds of things that we report out on, the kinds of things we gather information, and the way in which we share it out. And by understanding what's going well, it means that we can lean in, we can amplify and support that, and we can highlight it so that it doesn't feel hopeless, that it feels like we can actually do some great work together in the sharing of our wisdom and our knowledge and our capacity. So thank you for listening. This is actually what we want. I always like to end with this. So this is my friend Bradley, who is looking at his little granny, his granddaughter. And what I love about this, and what we are trying to create for our children, is when we look at our children and we are lifting them up, and we are bringing that love and that nurturing and that deep honoring of who they are, and we are addressing the things that are getting in the way of them having a beautiful childhood and a beautiful life. So that's what we're aiming for, and I thank you for the work that you do.